Okay, good afternoon and welcome to North Tyneside Council's Adult Social Care, Health and Wellbeing Subcommittee. I'm Councillor Karen Clark and I'm Chair of this subcommittee. The meeting is being live streamed, just a reminder to everyone, on the Council's YouTube channel to enable members of the press and public to observe the meeting. And I extend a warm welcome to anyone who is watching and joining us this evening. Before we move on to the agenda, I'd first like to make it clear who's participating in the meeting. So can I ask everyone to present themselves to confirm their attendance at the meeting? I'll read out your names, and after I call your name, please turn on your microphone and camera, introduce yourself, and then we'll ask the officers to introduce themselves also. So can we start with Councillor Trish Brady?
Councillor Trish Brady, Northumberland Ward.
Thank you. Councillor Joanne Cassidy.
Hi, Councillor Joanne Cassidy, Wheatslade Ward.
Thank you. Councillor Green.
I'm here. Hello, Councillor Muriel Green, Wheatslade Ward.
Thank you, Muriel. Councillor Joe Kerwin.
Hi, Councillor Joe Kerwin, Deputy Chair of the Committee and Monkston North Ward.
Thank you. Councillor Huscroft.
Hi, Councillor Nigel Huscroft, Northumberland Ward.
Thank you. Councillor Davis.
Hi, Councillor Kath Davis, Preston Ward.
Thank you. Councillor Percy.
Yes, Councillor Anne Percy, Churton Ward.
Thank you. Councillor Richardson. Councillor Richardson. You were there a moment ago.
I'm here again. Councillor Paul Richardson, Monkston North. Thank you. I'm struggling on my phone. Thank you.
Thank you. Thank you for that. Could I ask the officers in attendance to introduce themselves? Wendy, do you want to start?
Hello, good evening. I'm Wendy Burke and I'm Director of Public Health.
Thank you, Wendy. Scott?
Good evening, Scott Woodhouse, Strategic Commissioner Manager for Adults within the Local Authority.
Thank you, Scott. Joanne?
Joanne Holmes from Democratic Services.
Thank you, Joanne. In addition, we do have other officers joining the meeting who are providing technical support and cover in the event of connections being lost. So hopefully that won't happen. To ensure the meeting runs smoothly, can I remind participants to please turn off your microphone and your camera when you're not speaking. Please only speak when invited to do so by me. Activate your microphone and camera before speaking. If any member or officer does wish to speak, please use the hand raise button or you can use the chat facility. Okay, can we now begin, and we'll deal with the business as set out in tonight's agenda. Item 1, any apologies for absence?
Apologies from Councillor Mulvenna.
Thank you, Joanne. Any other apologies? Thank you. Substitute members tonight?
Got Councillor Thirlaway substituting for Councillor Mulvenna.
Thank you. And item 3, declarations of interest. Do any committee members have any interests that they would like to declare in relation to any items on tonight's agenda? Can't see any raised hands, so thank you for that. Moving on to item 4, minutes of the last meeting.
Chair, I have a declaration of interest.
Oh,
it's in relation to item 5. I'm employed by Parkside Care, which is a social care provider, and it's receiving financial help from the council during the COVID-19 pandemic.
Thank you for that, Councillor Thirlaway.
Thank you.
Noted. Sorry, so item 4, minutes of the last meeting, which were held actually on the 12th of March 2020, which was just prior to the first COVID lockdown. So that was our last formal meeting of the committee. Can we agree that is a true record of that meeting?
Agreed.
Thank you very much. Thank you. That will be confirmed and noted. Can we move on to item 5, the COVID-19 update? And we have Public Health and Adult Social Care. Can I invite Wendy Burke and Scott Woodhouse to present? Members will be given the opportunity to ask questions or comments after the presentations. Thank you.
Thank you, Chair. I'm just going to share my screen. I'm going to go first. I'm going to provide an update of where we're at in terms of the data, Chair, and then I will hand over to Scott, if that's okay.
Yeah.
So good evening, everybody. So this is just really to give you an update of where we are in terms of the infection levels across the borough. So what this slide shows is the number of positive cases in North Tyneside as of the 8th of February. So this is the most recent data that we have available to us. What it tells us in the last 7 days, we've had 329 confirmed cases of COVID-19, and that represents in the last 7 days an infection rate per 100,000 population of 158.2. You can see from the epidemic curve that we're showing a downward trend, although that downward trend is a slow downward trend. We are unlike most of the regions in the rest of the northeast. Sorry, we're unlike most of the local authorities in the rest of the northeast, in that we didn't see a significant steep increase at the beginning of January after the festive period. So our rate rose to 274 was the highest rate that we achieved at the beginning of January. That was compared to rates of in excess of 400, and in some areas of the northeast, rates in excess of 700. So we didn't see a really steep increase. So what that means is we didn't have as far to reduce by. And our downward trend, as I say, it's been slow. Over the last few weeks, it's kind of stabilised and plateaued a bit, but certainly over the last 2 to 3 days, we've seen a bit of a decrease, which is really, really welcome. So when we look at the infection rate by age group, again, we see a similar trend in that it's a downward trend in every age group across the borough. We're always worried about the over 65s because they're most vulnerable. We know that the poor outcomes from COVID are much more likely with increase in age, particularly for those over 70. So it's welcome that we're seeing a decline in that age group too. In terms of the testing data, we continue to still test as many people across the borough, and if anything, we've got more testing available than what we've ever had. And we tested in the last 7 days just over 15,000 people, and you will see that the percentage positivity rate of those tests that we're conducting is very low, and that's good. So as I said, 329 people in the last 7 days. We did have numbers as high as 500, so you can see that those numbers are coming down. I think it's fair to say, because of the Chronicle article quoting some old data, it was suggesting that the rates were going up in North Tyneside, so just want to reassure the committee that actually the rates are not going up. Obviously, we get quite a lot of daily fluctuation, and we have had some days where there's been an uptick in cases, and you would expect that. But on the whole, the trend is downwards. We've also had some comments about specific wards. I know that in the Chronicle they were highlighting Churton Ward as the highest in the borough. Actually, we've got 2 wards. We've got Wallsend West. They're not wards, sorry, the middle super output areas. So we've got 2 areas. We've got an area in Wallsend West, and we've got an area in Churton that do have the highest rates in the borough. But actually we're dealing with some outbreaks in both of those wards, and they quoted massive percentage increases, but actually the numbers in each of those areas are quite small. So you're talking about in Churton, for example, when I looked at the data today, 39 people tested positive. So you just need that number to go up very slightly for it to look like a massive percentage increase. So, you know, it all comes down to statistics, damn statistics. You can you can make the picture look very grim when in actual fact, you know, the cases had only gone up by a handful. So what this graph shows us is that out of the tests that were conducted in North Tyneside, 68% of those tests went to the specific lab to be tested for the new UK variant. And of that 68% of tests, in 82% of cases, the new variant was demonstrated. That's not unusual. It is a similar picture across the northeast and other places in England. And I just want to reassure the committee again that so far we haven't had any cases in North Tyneside of the South African variant. This is the UK variant, so this is the variant that was discovered in the UK in Kent. So it does show us that we've got a high proportion of the new variant circulating, and what that means is, you know, we should be concerned because we know it's much more transmissible. So those preventative measures that we've got in place have never been more important. In terms of the impact on the trust, both Northumbria Healthcare Trust and Newcastle Hospitals Trust continue to see high levels of activity. So this graph here is probably the most important. You can see we've still got a high number of COVID-19 patients occupying beds in Northumbria. If I show you the Newcastle data shows a similar high number of patients. That's because both of our trusts are providing mutual aid to other areas in the country. So their picture looks slightly different to the other trusts in the northeast who don't have the same picture because they're not providing the same mutual aid as our two hospitals. We anticipate that those rates of bed occupancy will come down, and both hospital trusts tell us they are managing with the number of patients that they've got, but it is very busy. In terms of deaths, this is what we've got in terms of the total number of deaths in North Tyneside. So the latest data tells us we've got 354 COVID-19 deaths where COVID-19 was mentioned on the death certificate within the last 28 days. Of those, 122 were deaths in care homes and 219 in hospitals. Again, and the numbers are not huge, but we know that every death is a tragedy for the family involved. In terms of the outbreaks that we're still dealing with a significant number of outbreaks across the borough, and they're in a variety of locations, from schools to workplaces to care homes, and also our NHS have got a significant number of outbreaks that they're dealing with in both hospitals, both at North Tyneside General and at NSEC. We're getting a lot of questions at the minute, about how can there be so many outbreaks in care homes when residents have been vaccinated. And I think the message is really clear from me tonight that, if you've had one dose of the vaccine, it is not going to prevent you from getting COVID-19. And if you're already quite poorly and you've got underlying health conditions, then the chances of having a poor outcome from getting COVID-19, even when you've had one dose of the vaccine, is still quite high. And again, the message is really clear. Even if you've had the vaccine, one dose of the vaccine particularly, we need to make sure that all of those other mitigations are in place while we've still got fairly high transmission of COVID-19 at a community level. So I think there's a lot of people, make the assumption that because a lot of our care home residents have had one dose of the vaccine, that it makes them invincible, and it doesn't. It gives a certain level of protection, but if you're really poorly already and you're also vulnerable, then catching COVID-19 may result in a poor outcome. In terms of testing, as I said, we're doing a lot of testing. I just wanted to give the committee a flavour of the testing that's happening, particularly the asymptomatic testing. So for people who don't have symptoms, using the rapid technology of the lateral flow devices. There's a whole raft of testing going on across the community. So we've got community testing for those who have to leave home to go to work. And you'll be aware our test site at the Riverside Centre is doing fantastically in its third week. Actually, this is its fourth week. In the first 3 weeks of operation, it tested 864 people the first week, it tested 924 the second week, and then in the third week it tested 990 people. That's fantastic. And we've got a range of different people attending there, from taxi drivers to supermarket workers to people who work in a nursery to people who are frontline in our council services. Community-led testing at specific locations is also available, and we're working with a range of locations at the moment to look at how we do that. So, for example, Mark Barrett's team, who provide the post-16 special educational needs education down at Norham, we've trained their staff on site to undertake testing of both staff and pupils. We are working with one of the mosques to again train their volunteers and their staff to undertake testing in the mosque. We're looking at testing for parents who attend for family time within our children's social care workforce. The other thing that's available is testing on site for businesses and workplaces who employ over 50 people, and that's a national testing programme. So again, we're encouraging a lot of our businesses and workplaces across the North Tyneside to get involved in that national testing programme. All of our primary schools are testing their staff at home. They've got home test kits. All our secondary, special and all through, and our college has got testing on site for staff, and also they'll be testing pupils when there's a full return to school. Universities have the technology to test staff and pupils when they return. Obviously, care homes are using the lateral flow devices for both staff, residents and visitors, as well as NHS staff who have got the testing kits at home. Hospices are doing it on site, as are prisons, as are the immigration removal centres. So a huge effort in terms of testing for asymptomatic individuals, and this will become even more important as and when the restrictions are lifted. In addition to that, of course, we've still got provision for people who have the 3 key symptoms of COVID-19, and obviously our local test sites can accommodate those, and we've got really good accessibility to those with good appointments available. In terms of the other things happening, oh, my computer's decided to go slow. There we are. In terms of the other things that are happening, in terms of contact tracing, we now have a local team of contact tracers in place. We've got 5 contact tracers in North Tyneside, and we went live with our local tracing partnership on Monday this week. We've established a partnership with NHS Test and Trace, and we are following up any cases in the North Tyneside area that the national team failed to get into contact with in the first 24 hours. It's great news, because we're able to get in touch with those people either by phone or by knocking on their door, and we're also able to offer a whole host of support to enable them to self-isolate. So that's great news. That just started this week, and we'll build on that as we go, as part of a regional ambition to have a locally based contact tracing service as we go. Our comms and engagement continues to be focused on restrictions and public health advice, and obviously the next big thing that we're awaiting is the national announcements on the 22nd of February regarding the government's plans for the next phase. Chair, that's the end of my presentation before I hand over to Scott, but I am happy to pause and take any questions at this stage if you think that is wise to do so.
Yes, thank you. That was really good. I think we will take this before we hear from Scott, please. Do we have any questions or comments? Councillor Thirlaway.
Thank you, Chair. Thank you, Wendy. That's a really useful presentation to receive. Just for clarification, I've got a few questions, Chair. The rapid testing, is that a single or is that a double? Is that a double test?
So we basically leave it up to the people who book in. I think some people are coming as a one-off, but actually we're encouraging it to be for people who have to leave home to go to work. So we're encouraging them to get tested twice a week if they possibly can. for some people it's just not possible to fit in with their shifts, but we are trying to encourage that.
Do they just take the single test? Because I know you can do the test twice to increase the accuracy.
It's just once. No,
just once.
They do it once, but we're encouraging them to be tested twice a week. If you're testing the same person twice a week every week, that actually increases the sensitivity and the specificity of the test.
Great, thank you. Where I'm not sure if this is for you, this is best for you or for Scott, but are we scrutinising care homes where outbreaks happen to ensure that actually there was compliance with the rules in the lead up to the outbreak? Because obviously every care home is different, and it's actually important to see where each care home is actually at regarding their restrictions and PPE and things like that.
We scrutinise that heavily. We've got a really good approach to that. So I have a public health lead person that looks into that, and that public health lead person meets with Scott and the team on a weekly basis. But we look at it daily, Councillor Thirlaway. We're looking at those outbreaks daily. We're particularly looking at the ones that start to escalate. So as soon as we start to see more than 2 or 3, we're on it straight away. And we would hold what we call an outbreak control meeting with the home, and we'd have a full discussion about exactly what the numbers are, who's involved staff-wise, what's happening with the staff outside of work, what they're doing in terms of the mitigations, and we'd absolutely be doing that. We also have the ability to send in the infection prevention and control nurses to have a look at what is actually happening. So yes, it's a really tight process, but that's a great question. Thanks.
Have we had any incidents in the borough where, because of an outbreak and staff self-isolating, that actually there was a lack of staffing available?
I mean, Scott will have a better view of this than me, but so I'll probably let him pick that up.
Thanks.
Thanks, Wendy. Thanks, Councillor Thirlaway. I think we have had a number of circumstances where providers have struggled and have been in a position whereby staff who are self-isolating have impacted on delivery. I think overall, though, working with those providers, we've been able to shore stuff up and work alongside them to support that. I think where it gets increasingly difficult is where it's a nursing home and it's nurses on site.
Yeah.
And you know, I think just the capacity there to drum up nurses is particularly difficult. But equally, you know, we work with the whole market and look at how that market can support, as well as local authority staff and NHS staff, so community nursing, Northumbria, etc., that we would sort of pick up the phone with and have conversations with. I think what we find as well as part of that whole process is that there's generally only a critical period for a short period of time, because staff start to get through that 10-day isolation period and start to come back throughout that process. So, you know, the critical period can be, you know, really quite short in particular, you know, 2 or 3 or 4 days.
Great, that's excellent. I've just got one more question, Chair, I promise. It's regarding testing, Wendy. It seems that we seem to be doing a lot of testing in the borough. How does that compare with the rest of the North East?
Yeah, our rates of testing are comparable with other areas. I think I think testing is now in the psyche of people, so I don't think there's the same reluctance to come forward for testing that maybe we've seen, because we've got such a rollout of particularly the rapid testing. So I think we're on a par. I don't think any area struggles with testing, and I think we're not doing any more and we're not doing any less. We're on a par.
That's great. Thank you.
Thank you for that. Councillor Kerwin.
Thank you, Chair. First off, I'm really pleased to hear about our local test and trace. I think, Wendy, you'll be well aware that members of the committee have been wanting the government to support local authorities to do something like this for what seems like a very long time. I know it's only been up and running since Monday, but I was just wondering, so what happens in a situation where it might be passed to us because test and trace haven't been able to contact them, then we haven't been able to contact them. Do we pass it back to the national test and trace system, or what's the next steps?
So we have the ability to do that. We haven't had to do that so far. So we have managed, we don't get masses of numbers at the moment because actually, in fairness to the national test and trace system, it is working much better than it ever was, Councillor Kerwin. So we're probably on average, probably not getting more than about 8 to 10 cases a week because it's only when the 24-hour period hits that they then transfer to us. But I guess what we have at our fingertips is the ability to cross-reference with other council data to see how we might be able to best get in touch with people that haven't been contacted by the national team. But we've also got the ability to send our contact tracers out and knock on people's doors or put stuff through the front door through the envelope, which the national team wouldn't do. So it hasn't arisen yet. We've not had to hand any cases back. And we've not been able to contact anybody. So far, so good. Our next stage potentially is to take cases after 8 hours. So after 8 hours of the national team having them, we've got that ability to take it. But obviously we want to embed the system. We want our contact tracers getting some expertise before we move to that next stage. But that will be the next stage that we move to.
That's really reassuring because I know nationally at the minute it's 10 calls and then if they're not contacted sort of goes off into the ether and everything. Just one other question. Are other local authorities nationally or regionally also picking this up now as well?
They are. We've got an agreed Northeast regional approach that all 12 local authorities are now signed up to. What the first stage is called a local tracing partnership. And I think every area is signed up to that now across the Northeast. But we've all got an ambition to have a totally localised system at some point in the near future, and we're all working towards that.
Brilliant, thank you.
Thank you for that, Councillor Kerwin and Wendy. Wendy, I've just got a couple of questions. I can't see anyone else's. Oh, Councillor Richardson's just put his hand up, but I'll ask first. I just squeezed in there, I believe. It was just about the testing, Wendy. I know you said that there's a national scheme where businesses that employ over 50 employees are able to do testing or have test kits provided. I'm just wondering, is there nothing on a local level we can do for smaller employers? Because I'm just thinking about organisations that work on the front line, particularly in the community voluntary sector, where we haven't got the opportunity to test our staff and they're still having contact with quite vulnerable people out in communities. So I'm just curious, is there any possibility of that happening in the borough?
So that's really why the test site was set up at the Riverside Centre for those smaller organisations. And actually, we've got quite a number of small businesses that are accessing that and self-employed people who wouldn't normally have the opportunity. We have got the ability, if any organisation is interested that's got below 50 employees for setting up their own test site, we have the ability to support that. I guess our big issue at the minute, Karen, is that it's capacity in our public health and in our testing team to enable that to happen, because we would then have to, and we've got the kit, it's not the kit, it's the time taken to help that business set up a test site, because there are lots of hoops to jump through. You can't just immediately do it and staff can't do it at home. You've got to establish a test site with that local business, with those on site, and they've got to work through a full protocol. So it has to be done, properly, and it takes a bit of time to do that. But if anybody's interested, they can contact me and we can have that conversation. But we're not publicising that because we do have limited capacity. Whereas the scheme for businesses with 50 plus employees, that is done nationally. So support is provided for that via the national team. And obviously they've got much more capacity than what we have at a local level. Does that make sense?
It makes perfect sense. Thank you, Wendy. It's just I have had a few people asking that question, so I'll just raise that. And also the other thing, people are concerned about the accuracy of the tests. Wendy, has that improved at all, or is it still the same as the early reports? you know?
Yeah, no, I mean, really, the accuracy of the tests has been estimated to be anything from 50-odd%, you know, right up to kind of 80-odd%. And it depends what document you read and where it's been piloted. What we know is the thing that makes the tests more accurate is making sure that you've got staff who are absolutely and utterly well trained to conduct the test, and that they're competent to use the protocols that have been developed nationally. So the more competent your staff are, the greater the accuracy of the test. Plus, if you're testing the same person twice a week, every week, that also increases the accuracy. So that's why it's really important to do it properly. Yeah.
Okay, thanks for that. And just one more, I suppose, building on a point raised by Councillor Thirlway in relation to care home. I was more thinking about the care home staff, and there's been some reports in the press recently about care home staff refusing to have the vaccine when they've been offered it. Is there any correlation between any care home outbreaks of COVID and staff having refused to have vaccines?
I mean, I think it's probably too early to actually say whether there's any impact, and I know that Scott's going to cover that in his presentation, so I'll not steal his thunder, because I usually do. But this time I'm going to refrain.
Okay, thank you. And Scott, we'll hang fire and wait for that in your presentation.
No problem.
Councillor Richardson, were you still wanting to speak? I can't see your hand up at the moment.
Thank you. No, that was my question about the efficacy, if that's the right word, of the test, because there's obviously a lot in the press, but that's a good answer. Thank you very much. And thank you again for all your work and the presentation tonight.
Thank you. And thanks again, Wendy, for that really interesting report and update. Can I hand over to Scott Woodhouse now for an update on adult social care? Thank you.
Thank you, Chair. First couple of slides are the same slides as I've presented to previous meetings, but just really important to give a reminder in relation to the context of the work that we're doing and how we're supporting the market, individual providers, and looking at the overall objective of protecting residents and staff delivering the care and support. But it is part of an overall overarching wider local authority and NHS support to the providers in the market across North Tyneside. Just some general information about the care market in relation to numbers, services, numbers of places available within those services, or people accessing those services, and then the staff numbers. So we've got some significant numbers of services and provision across the borough, as well as, I think as you've highlighted previously with the community and voluntary sector, a much bigger cohort of numbers there. These are mainly the commissioned services and providers that we've got. Just in relation to outbreaks, I know Wendy touched on it, but this is just a bang up to date snapshot of where the outbreaks are at the moment and in relation to North Tyneside. We've got a consistent number of outbreaks over the last number of weeks of 11 homes. Some homes are coming in, some are coming out, but it seems to be a fairly consistent number for a number of weeks now of 11 or so. And just as a reminder, a home is an outbreak where there's 2 or more cases, staff and or residents of COVID positive. So a number of homes have low numbers and are in outbreak because they're saying out a 28-day period. But equally, there are some homes where there are some significant numbers and have been some significant numbers of staff and residents with COVID positive tests. Just in relation to the market generally, we are seeing an increase, and have seen for some time now, an increase in the number of vacant beds across the sector, and there's a breakdown there to show what that has looked like over time, and there's been a gradual increase, certainly over the last 12 months. We're currently running at about 20% vacancies. A year or so ago, it was about 7-8%. So that has an impact on providers and the market, particularly around care home provision. Just picking up on immunisation within the Green Book, which is the Bible that's supporting the whole vaccination programme, and it's available through the link there. The current priority to the 15th of February is to get through those 4 priority groups, so care home residents and staff, those over 80, frontline health and social care workers, 75 years and over, and then clinically extremely vulnerable individuals and those that are part of that shielding list. And I think certainly, I'll come on to it, but I think we're certainly on target to get through those numbers by the 15th of February. So for care homes for older people, we've got 31 in the borough. All eligible residents and staff have been offered the vaccination, and that's the take up, 91% of residents and 87% of staff. Within that number, some are unable to be vaccinated, and that's generally where somebody's had a positive test in the last 28 days, where there's health conditions that preclude that, or where somebody's either pregnant or wanting to become pregnant. There's some guidance in there around that. However, and that comes back to your point, Chair, there are some individuals that are unwilling to have the vaccination, and we are working closely with colleagues in the CCG and Northumbria to reduce that number. It's currently at around 10% overall within care homes across the borough, and that does vary from care home to care home. Quite a number of the care homes have no staff that are unwilling and have a 100% vaccination, whereas in some other homes that's not the case. But we have put a series of sessions on with those providers and with the market generally to work with the managers and with staff in the homes. And on a webinar that we held last week, we did actually have a number of staff on the call and listening to the likes of Wendy, to Leslie Young-Murphy from the CCG, and Dr. Dave Thompson, GP, to talk about the reasons why we all think it's important that people are vaccinated. In relation to specialist homes, so learning disability, mental health, physical disability, we've got, I've said 13+1, we've got 13 homes, and then Heatherfields, which is in the northwest of the borough, is an older person's home, but has a 20-bed physical disability unit as part of it. And again, there's been an offer to residents and staff, and those vaccinations are currently being undertaken as we speak this week. And so by the end of tomorrow, the nurses will have been around all of those homes vaccinating individuals, staff and residents. And then we've got a series of mop-up sessions in place. I think they happen on a Thursday, where the nurses go around the homes based on referrals in, and that's picking up either new admissions to the care homes or people coming out of hospital where they haven't been previously vaccinated, or those individuals that are coming out of the 28-day period and would benefit from a vaccination. And there are some individuals getting picked up in there who have changed their mind from not wanting to be vaccinated to be vaccinated. So that's good news as part of that process. And I think we do see that as being a bit of a rolling programme over the next number of weeks. And then vaccinations for health and social care staff, you recall on the priority list, that's one of the top 4 priorities. So the NHS is leading on health staff and the local authority for social care staff. There has been a regional approach to all of this through North East ADAS, and Jackie Old, as our director, has led on that for the North East ADAS group in relation to vaccinations. So we've had a really tight steer on that and taken that forward. That just covers not just a range of people that work within the council in internal services, but also individuals working in external provided services, commission services, and community voluntary sector, and a range of other sort of related services that are out there. We've had an inclusive approach to all of this, and got through a significant number of vaccinations over the last 4 or 5 weeks. So again, the ambition from government was to have all staff offered a vaccination by the 15th of February, and we've achieved that. There are still some people who are just waiting to get booked on to get their test, their vaccination at the hospital hub at Northumbria. But everybody has been offered a vaccination, and again, the overall aim of that is to maximise the numbers to get vaccinated, and again minimise any numbers that of individuals and people that are unwilling. And then just I thought I'd pick up just as an aside to that, just some of the work that we're doing to continue to support hospital discharge. I think as Wendy said in her slides, whether it's Northumbria or Newcastle hospitals, they've got some really high numbers of people in hospital, so we've had to work hard with colleagues across the health and social care to support hospital discharge for those that need to come out of hospital, and to free up places for people who need to be there, and just make sure that some of that happens at pace. So we've now got a designated setting in place to support discharges back to care home settings, and that's at Hadrian House in Wallsend. We've got 18 beds there that are commissioned by the local authority and funded by the CCG. That arrangement's in place till the end of March, subject to where we are with the numbers and continued funding from government to the NHS to support that. It is stepped down from hospital for COVID positive patients. The stay there for up to 14 days to see out the period of isolation, to then go back to their original care home that they came from originally. There is a CQC assurance process in place, so that designated setting has to be agreed to by CQC, and have been out in advance of it being established back end of last year to do that. And ultimately it ensures that there's a good flow from hospital, and keeps care homes safe and that resident population there. I think if you look at back in sort of March, April, May last year, there was a lot of discharges from hospital of potentially COVID positive individuals back into care homes, where there was the potential for transmission of infection and the disease to those residents in care homes. And the graph at the bottom is just showing a summary of the beds, and the blue line is the usage, and the orange line is vacancies. So again, we're just monitoring that. It's never been full, but what it does provide is capacity in the system to allow that swift discharge from hospital. We've also got the reablement support team, reablement team who's supporting people back home as they would do normally, and again it's just making sure that they're picking that up and supporting people through that discharge pathway. And what we do know is from that is that the commissioned home care providers are continuing to pick up care packages for people in the community, including hospital discharge, which is a really good position to where we were 12-18 months ago, where there was a waiting list of 100 plus individuals waiting for packages of care to get picked up by providers. And I think this is the final slide. We've got also in place to support hospital discharge, 20 intermediate care beds at Royal Quays in North Shields, and also 20 at the Howden unit in Wallsend, and they're used as part of a discharge pathway where people need an accommodation-based rehab provision prior to going back home, and supported there for a short period of time. Might be a few days, a few weeks, etc., until they get back on their feet. And there's a whole MDT process in place around that with OTs and physios and other disciplines supporting people as part of that recovery pathway and people getting back home. We don't have any delayed discharges and haven't had any delayed discharges in hospital for some time now, so that's really good, especially where we're in that pandemic situation, and really having to deal with getting people out of hospital really quickly. And we do know that because of the ongoing pressures of COVID, that whole timely discharge and doing that at pace and getting people out of hospital where it's not ideal for them to be, getting them back home or to a care home setting is the ultimate priority of that work. Thank you.
Sorry, my microphone's on mute. Thank you for that update, Scott. Are there any questions or comments from committee? No, can't see any hands. Oh, Councillor Trish Brady.
Thank you for that, Scott. That was really helpful. I just wondered, in terms of I was encouraged to hear the work that you have been doing in relation to uptake of vaccination care home staff. I just wondered what you were finding the barriers to take up were for those who are reluctant, you see.
Yeah, I think, as I said, we held a webinar last week, last Thursday, and it was helpful and insightful, and it was done as more as a question and answer session rather than us doing a presentation and preaching to people. And I think certainly what I got from it was that there was people were just uncertain about it, and had some really good questions about particular health conditions that they had, or what was in the virus, and but equally there's a lot of stuff on social media, and people are reading that and believing that, and but also I think in some homes there's maybe some staff or cohort of staff that are really quite resistant, and it's just how they play that out with colleagues, and if you've got a really strong member of staff within the home who believes this, then if they're in dialogue with colleagues, etc., then I think maybe people are more likely to pick up that from work colleagues. So again, it's working with the managers to give them the tools and then the information to a bit like a Mythbuster type scenario, so they can understand the issues and give that response. And what we're hopeful of is, again, as people have gone through that vaccination process and they've seen their colleagues go through it, and nobody's been adversely affected by it, and certainly residents haven't either, then hopefully we'll see that benefit to it. I think, and again, it's just really doing that work with overall probably half a dozen or so care homes where we just need to do some more focused work across the Local Authority Commission and Public Health, and with Northumbria Infection Control, and with the CCG. So we've got a really strong approach to this, and try and support people to change their minds and get vaccinated.
Great, thank you. I think it is really important to challenge that misinformation, isn't it? Because there's so much of that out there, particularly on social media.
Yeah, I think just to follow up, I think one of the things that the care home owners, the directors, the proprietors, etc., are starting to become concerned about is for new residents coming in, if there's a perception that their home has a number of staff that haven't been vaccinated, would that put off new residents moving in, and will that affect ultimately the business and the viability, etc., etc.? Because if you remember on the slides, the numbers of vacancies overall have shot up over the last year. We have got some homes that are particularly concerned about. Add to that reduction in new admissions, that's going to play into a woeful situation for some of those homes.
Thanks very much.
Okay, thank you for that. Are there any other questions or comments? Report? No, I can't see any hands up. Can I just say a huge thank you to Scott for that update, and for Wendy. I think just a couple of key things for me. I think it's great to hear that overall there's a downward trend in North Tyneside. Obviously, we had those concerning reports in the Chronicle, so it's good to hear and have that put in perspective as well in terms of numbers. I think it's also encouraging to hear we haven't got the South African variant in North Tyneside. We do have the new UK variant, so therefore the preventative measures are ongoing and very important. Our hospitals are busy, but they're coping and doing an amazing job. Obviously, we're very sad that we have deaths, and condolences to all the families out there, but great to hear new developments in the testing and the contact and tracing. And Scott, brilliant to hear that we're working our way through the priority groups, and that includes care homes, obviously still working around trying to get everyone to take up the offer of the vaccine. But fabulous. I just want to say that obviously there's always going to be opportunity for improvements and challenges, but COVID has presented unprecedented challenges to everybody all round, and I think it's required a massive team effort, a partnership effort across all the services, communities and residents, and I think everyone just deserves a big thank you, working in extremely difficult circumstances and trying to deliver the best for our residents out there in North Tyneside. So thank you for that, everybody.
Okay.
We move on to agenda item 6, which is feedback from the Livy evaluation group. Can I invite councillors Richardson and Kerwin to provide feedback from the recent meetings of the CCG Livy evaluation group, which they've attended as a representative of this subcommittee? Thank you.
Thank you, Chair. I'm going to start largely to do it chronologically. The CCG set up this evaluation group, I think partly at our request. I went to their first meeting in mid-October, which I have to say was a very introductory meeting. And there were really only 2 or 3 bullet points that I brought away from that. One was that there was a conversation about the model that they were going to use to do this evaluation, and there was a little bit of skepticism as to the likely slant and detail in that, which was kind of noted and then held over till the next meeting. There was a straw man put forward in terms of a model, which they asked for comments on from the committee before the next meeting. In terms of how to best evaluate objectively what was going on, rather than take it all, for instance, from the Livy numbers. The only other thing I really picked up from that first meeting was there was certainly disquiet, no stronger than that, about the clinical implications of this. It's not a proposal, this project, and a number of people said they were specifically worried also about mental health patients who were, to paraphrase, likely to go and ask the same question to somebody different in the hope of getting a different answer, which wasn't perceived as a very helpful setup. So they were the main points to come out of it. The next meeting was scheduled for mid-December, and intriguingly that was then cancelled. I cast no aspersions about that. It was cancelled because of diary clashes, apparently. So there's been something of a hiatus. The next meeting was then called in January, and sadly I couldn't go to that. I had a hospital appointment, and Councillor Kerwin volunteered kindly to stand in for me. So I'll hand over to him, but I wanted to just put that context in first, because I think a lot of what he's now going to report on, is within that framework.
Yes. Thank you. So, yeah, I attended the meeting on the 13th of January, I think it was, and I've since been sent the minutes and notes from that meeting. However, the CCG have asked that they are not shared, so rather than me sharing the actual documents, what I think is appropriate of me is to report back my notes from the meeting, and in my notes I'm not naming certain people because obviously it wasn't a public meeting when statements were said. So yes, the meeting started with a presentation on a survey of those who've used the Livy project, and just to give you the headlines from that survey, it said the vast majority of patients had a really positive experience. 81% of the patients received medical help through Livy. 84% of the patients rated their Livy experience very good or good. The convenience is the main driver for their use, and that Livy are seeing a larger number of people recommended by their GP, nurse and practice receptionist. And of the 28% who've used Livy, and of the people who have used Livy, 28% of them have used it more than once. And this all seems very impressive until you realise that this actually is a survey of only 56 people, and it was a survey conducted by Livy themselves, which casts some aspersions on the reliability of the data. And outside of the meeting, I've since been told, off the record, that Healthwatch have now been commissioned to do a similar survey, and it is producing remarkably different results. In the meeting, one of the GPs did raise an issue that the Livy questions were not good enough to find out actually if they were having any impact on the services. And a member of the CCG team did admit that actually there is no evidence, or that they can't say for a fact, that Livy reduces pressure on other services, which we have been told in the past is one of the major selling points for Livy. A brief conversation took place on how the CCG haven't worked out how to monitor the change of the workforce. So are GPs locally or nationally leaving practice to take up roles such as Livy, and what the impact that might have been. And the CCG are going to be working more closely with Livy to sort of understand who the Livy workforce is, and actually are they just taking the GPs out of North Tyneside to pay them again to do this type of work. But we don't have the answers on that from the CCG yet. We went through the statistics, which were measured through, I think, the model partly, which was discussed in the meeting Councillor Richardson were in. So again, this was meeting of the 13th of January, so the stats were from that time. At the time of the meeting, there was 9,328 people who had downloaded the Livy app in North Tyneside, and Livy, in the entire time it had been running in North Tyneside, had delivered 3,344 appointments. The practice with the most patients registered with Livy was the Priory Medical Group with 738. And just for a matter of interest, the practice was Park Road Medical Group, which only had 3 patients who had downloaded the app. In the report we had, they were measuring what a week previously had looked like. And in the week they were reported on, they said in that 1 week, Livy had provided 174 appointments. And to put that into a bit of context, one of the GPs in the meeting raised an issue that 174 appointments is a very small number, and that their practice alone offered 800 appointments a week. So if you take the 800 appointments and times that by 33 practices in North Tyneside a week, this is obviously assuming each practice offers 800 appointments like the one mentioned, then you get 26,400 appointments available through practices, and Livy were offering 174 appointments, which does raise some questions around the cost of Livy, and is it worth it for 174 appointments? However, again, we don't know, because we don't know how much is being spent on Livy at this moment in time, because we were told that was commercially sensitive information. Someone from the CG referred back to the survey and said that patients were happier with Livy than their GPs. Obviously, that didn't go down well with the GPs in the room. And the GPs pointed out a number of things, including that the cohorts couldn't be compared because of the type of people that were accessing Livy being of the younger demographic, age demos, and also the fact that Livy only deals with some medical conditions, and the people more likely to see the GPs are those with comorbidities. And also the information came from a Livy conducted survey again. So the conversations moved on to the next stage of Livy going forward, and we were told now that GP practices could directly refer into Livy, and if you have already downloaded the app, a GP receptionist or practice manager could directly book your appointment. If they haven't downloaded the app, they could still promote it and encourage you to book an appointment. I personally feel this contradicts completely what we were told by Dr. Leslie Young Murphy when she came to the previous informal meeting of this committee, and when she met with myself and Councillor Clark, when she told us that GP practices would not be promoting or referring into Livy. Because to me, what this now means is that the money to provide virtual appointments isn't going to practices, it is going directly to Livy, but the work, the backroom work and all the swab work of booking up those appointments is actually being done by the GP practices, and they're getting no money to do that side of it. People will have also noticed that there are 2 digital vans or digivans circulating North Tyneside promoting Livy. This was agreed by the CCG that they could do that, and they've agreed a route which includes circling vaccination sites. This did raise some concerns amongst the GPs. The route was not shared, but we were reassured that the vans were not allowed to park up at vaccination sites. However, since we've had one broken commitment around GPs promoting, or GP practices promoting and booking in Livy's appointments, I don't feel overly comfortable with that reassurance. Like I mentioned, the route wasn't shared. People also might be aware that Livy have had adverts placed in vaccination sites and are doing other types of advertising, which, you know, they are a private company, they're allowed to advertise, that's not a problem. And can't stop it. However, it does raise other issues around the concerns of long-term stability if it's needing to invest this much in its promotion and use NHS funds that directed towards practices to continue its own promotion, money which should be spent directly on patients. Livy have also started providing practices with merch or freebies, such as Livy branded face masks and sanitation stations donated to practices. Some members of the group were very excited about this. Personally, I'm not comfortable with that. I think it's, I would say it's partly nefarious or insidious, or whatever the right phrase might be. It's almost like buying people off with goodies to say, look how lovely we are, in my personal opinion, not speaking for the committee there. So yeah, and that's where the meeting concluded. I know the next meeting is taking place on March the 9th, from what Councillor Richardson told me. And he mentioned to me earlier that we would both probably appreciate a steer from this committee on your views on how we go forward. So yes, that's my report of that meeting. I'm happy to answer any questions on that meeting.
Lovely. Thank you, Councillor Richardson and Councillor Kerwin for that update. Can I ask Trish Brady to come in there, please? And that'll be followed by Matthew Thurloway.
Thank you, Chair. It's perhaps a naive question, but Did the CCG state the intended objective of the contract? You know, was there a baseline idea about why they were letting the contract? Because there were various suggestions going around about why it was happening at that particular time. So it'd be useful to have some clarity. Thanks, Joe.
Yeah, so offering virtual appointments is part of the NHS long-term plan. So it is expected that every CCG and GP, as a result, will be offering virtual appointments. The CCG did assure us that they looked at all these other options, including providing the money to GPs themselves to provide these virtual appointments. This was all this legwork was done before the word COVID-19 was in the common lexicon. And actually, what we found is throughout COVID-19, GPs are now offering the virtual appointments as well. So the CCG told us Livy was the best option. I think the pandemic has proven that the GP practices can offer virtual appointments and they can do it well, and people like their own GPs. But that was Livy's reasoning behind it.
Yeah, I know.
Also, the CCG's reasoning behind it.
Yeah, I know there was some issues around the technology initially and whether it was secure enough for patient appointments and dealing with the patient notes and so on. But I think you're right in that the GPs have come up with their own solutions for that because they've kind of been forced to, haven't they? Yeah. Thanks, Joe. Thank you.
Thank you for that. Councillor Thirlaway. Have you got your sound on, Matthew?
I'm having problems with my mic. Can you hear me now?
Yes. Yes.
Thanks. Obviously, I'm not a member of this committee, but I've taken a keen interest in the Livy pilot. And I'll try not to mince my words, but everything about this deal, this pilot between the CCG and Livy stinks. It absolutely stinks. You know, there's serious questions that both Livy and the CCG still need to answer about this deal, and they haven't done it. Firstly, as councillors in the council, we have a large responsibility towards public health. We weren't consulted, the council weren't consulted. I understand Wendy Burke was told a week before leaflets were distributed in North Tyneside. Councillors only found out about this when leaflets were put through their doors, and I think that's absolutely outrageous, especially from the CCG, which is a public body. It shows real contempt towards councillors, elected officials, and I think there's a lot of things I have real concerns about, but I think this represents everything wrong that's happening to the NHS. This is privatisation. That's what it is. It's nothing more. It's nothing less. You know, it's about taking money from the public, from the taxpayer, and giving it to private companies to deliver private healthcare. You know, things are only going to get worse if this pilot is allowed to be continued after the 12 months. And I think we really need to be clear on this. And I know the Labour Party is clear on this. That the contempt we should show this pilot, even just on a political stance, never mind actually the fact that it stinks. I think, and I'm not saying this to the committee, I'm saying it in a general sense because I don't want to sort of compromise Joe as he's sort of dealing with this group. But I think
intervene.
Yes.
Sorry, there's a bit of. It's just to say, whilst we all appreciate the passion around the politics, the committee's a non-political body as such, whilst obviously we all represent our political party. So I just need to point that out.
Yes, I absolutely understand that. But I do think that as councillors, as elected representatives, we really need to take this very seriously and what it means for the future of public healthcare, because, you know, there are serious questions that need to be answered and addressed by both Livy and the CCG. So that's basically just my say, and I'm sorry I'm stepping on any toes. I'm only the sub tonight, so I thought I'd have my say anyway. Thank you.
Absolutely fine, Matthew, and thank you for your contribution for that. Did you want to respond in any way, Joe?
I agree with Matthew.
Of course. What he said. Thank you.
Can I bring in Kath Davis next, please?
Thank you, Chair. I'm actually at the Priory Medical Group. That's my practice, and they do have like Livy hand sanitizers and Livy plastered all over the reception area, and they didn't get a very good. It was a few years ago. They didn't get a very good grading from the health board at the same practice. What I'd like to know is like the 56 people that this Livy have done this the sample for. What was the demographics of the age and things? I mean, my mother is she's in her 80s now, and she's got ongoing health problems, and all they're offered is now is because of COVID, like telephone appointments, and then you eventually do go to see the doctor. And I'm just concerned about people who aren't sort of tech savvy, you know, the older generation, who will find it like it's a minefield of trying to get through. And it is, I mean, my own belief is healthcare is a personable thing. It's about the relationship as well. That's half of the medical care, is your relationship with your practice doctor and things like that. In that kind of like, I don't know, sort of like nurturing aspect as well, which I'm concerned is going to be lost in like all this virtual things. And I just wanted to know what the sample group, the age demographic was. Thanks, Joe.
Yeah, so I just went through every page there of the original survey, and there is no information provided on demographic data. However, anecdotally, what was mentioned in the meeting is that there is a younger cohort who are using it. However, in other conversations with people in Health Watch, they have also raised the issue of the digital divide when it comes to economic status and being able to afford the phones which run Livy apps and so on. So is the CCG funding a service which isn't actually as accessible as it can seem, even for the younger cohorts? So yeah, unfortunately I can't answer that question in any great detail, sorry.
Okay, thank you, Joe.
Are there any other comments, Trish? Councillor Brady's, oh, your hand's gone. Are there any, oh no, it's still there.
Yeah,
come back, Trish.
Thank you. Yeah, I think I share the concerns about the Livy contract. Although I have to say, you know, it pales into insignificance compared with some of the massive contracts that have been given during the last 12 months to organisations like Serco and Capita that are just creaming off funds from the NHS. These are the things that we really need to be considering going forward. I think we do need to ensure that there's a robust evaluation of this Livy contract, because like it or no, there will be virtual consultations going forward. I think what I would like to see, and I think we are going to be seeing a change in the relationship in the commissioning environment going forward from April. I don't think we're going to see any CCG mergers in this northeast region, but there will certainly be a sea change around primary care. And I think we can see, I know, for instance, Newcastle has been much more proactive as a local authority in engaging in that place-based work, so that we really have a voice with the primary care networks. And I think we've got to step up a little bit to that. I think it's you know, it's fair enough to say we should have been consulted, and that's true, but also I think we need to be reaching out and doing some of that groundwork ourselves to make sure that we are, you know, as local authorities at that table and having and shaping those services and those, you know, how the money is spent going forward. Thanks.
Thanks, Trish. I mean, I'll just come in there. I can't see any other hands up at the moment. I just want to say, you know, I totally agree with the sentiments of basically everybody on the committee in terms of the frustrations. I think the ongoing frustrations around the way, you know, as elected members were often not consulted and not included in these processes, and considering the communities we represent, that is totally unacceptable, regardless of their political party, but it's unacceptable. I also totally agree with the sentiments around privatisation, but I will point, and obviously it's not to distract from that, but I have bigger concerns about the more wide-sweeping changes currently underway. Trish has alluded to there, that potentially opens up the potential for much wider privatisation of our NHS. So massive concerns there. But if we're talking about and focusing here on the Livy contract, then I think the killer question really is, you know, I haven't heard anything from you, unfortunately, from your updates and feedback that alleviates any of the concerns I think that we expressed in those early meetings, Joe, with CCG representatives and when we came along to our informal committee meeting. And, you know, you presented statistics and there isn't any evidence, and it's silly really presenting percentage statistics on a number like 56. It's you know, it's a statistical nonsense really. So I think all of that said, I mean, I suppose the key question is, have you got enough going forward, Joe and Paul, because I don't think we've properly answered the question you asked us at the end of your giving you a steer. I don't think we've quite got there, have we?
Let me come in on that first, please. I'm due to go to the meeting on the 9th. I haven't had an agenda yet. Not surprisingly, it's a little way off. But it sounds as though, and I'll talk to Joe again in the interim, but it sounds as though our concerns, apart from the fundamental ethical issue, if you like, boil down to frustration about lack of transparency, both in terms of some of the concerns that you two voiced originally and now going forward around changes to the original plan, as well as the success of it, in inverted commas, you know, the use of it, the uptake, as well as some of the practical considerations that GPs have voiced at both meetings we've been to. So, I mean, that sounds like a bit of a mouthful rather. But I think they're the big headings, and then given the opportunity, we can drill down into some of the specifics around the CCG's monitoring of the project. Because if they're not providing, you know, useful and transparent data to monitor it, then, you know, there's only one real conclusion that one can draw.
I mean, I find it a bit ironic just on that note, because usually the way when you're going to evaluate something, you almost have to know in advance. You know, you set that evaluation criteria before you start to deliver something. So it's a bit worrying that you know, that's not in place, that those, you know, indicators and measures, and there isn't a clear understanding of that. And given that it's supposedly a one-year pilot scheme, there's not a lot of time to develop that. No. So the time's ticking as we're going along. So I find that a bit concerning. So yes, I totally agree. That's a key issue there.
Absolutely.
Do you want to say something? Oh, I've got Councillor Muriel Green. I'll bring Councillor Green in at that point. Thank you.
Absolutely splendid presentation. Thank you very much indeed. And I think we're all a lot wiser on it. Very simple questions. How long is the contract for? Because I don't know whether we've actually been told, is it? And what we need to be careful of is that the changes that are coming up with the health service, what's going to happen to these? Are they going to be carried on? Are they going to be swept up with the carpet? Are we just going to see them disappear into a black hole of privatisation? So I think the future is something we've really got to consider as well, things like this. Thank you.
Yeah, so just to say, it's when we say a one-year pilot, it is a bit longer than a year. And yes. I don't know if Councillor Richardson was looking up the exact end date at that moment. But yeah, I completely agree with Councillor Green. We also have the issue of the new government white paper that's coming down the line on NHS reorganisation and what that will mean again for us. So I think we just need to be ready as a committee and ready as a council as well with a clear position on this. Who knows, maybe at the March meeting we'll hear something that completely, Councillor Richardson will hear something that completely changes all of our minds. But at the minute, I don't think that will be the case. And I just wanted to touch on something that was mentioned before that I failed to mention, was to say that virtual appointments are going to be here to stay. Like I say, they are part of the NHS long-term plan. Our issue should be that how are they delivered? Who's delivering them? Is it value for money? Because yes, we have our ethical concerns around NHS privatisation, and I do not feel a private company personally should ever be involved in it. But if we are spending a significant amount of money for an organisation to provide 174 appointments a week, then it seems ridiculous. Sorry.
Yes, can I just go? I think Joe's absolutely right. There doesn't seem to be any reason why the GPs just cannot take this on as part of a natural service, because it's the modern way of keeping in touch with younger people in particular. So I think this should just be a natural part of the progression of the services that GPs can provide. And that's the way I see it. Thank you.
Thanks for that, Muriel. And sorry, can Matthew, final point, and then I'm going to hand back to Paul and Joe to sum up.
Thanks, Chair. Just to ask some specifics. When does the evaluation group plan to sort of wrap up? Is there a time scale?
As far as I'm aware, it's the life of the project.
Right.
Which I can't find it in my notes, rather embarrassingly, but I have July in my head.
Right.
So whether July is the end of the 12-month period, or whether last July was the start of it, and as Joe said, it may go on for slightly longer than a year. But the evaluation was supposed to last for the length of the trial.
Great. And just one more. Is this a rolling contract, or does the CCG have to commission Livy again if it wants to sort of renew this scheme?
So we were told at a previous, I can't remember if it was the meeting with myself and Councillor Clark or the informal meeting, but we were told that if it was to go forward, it couldn't roll on. It would either have to be a tendering process. So they couldn't just give it to Livy as a permanent contract. As I say, I can't remember if that was the meeting with myself and Councillor Clark or the informal meeting.
Great.
I think just to come in there, Joe, I seem to recall we raised the issues about the lack of the consultation and information, and we were informed because it was a pilot, there wasn't the same requirement or legal requirement to do that, but if it did become issued as a contract, then presumably there would be an obligation to consult and do that. So that was my understanding. Thank you.
Great.
Sorry, I'm just going to, Matthew, was that the end of your comments, or did you have anything else?
I was just saying that's a bit more reassuring, rather than there's a cut-off point where you can't sort of stop commissioning Livy, and that actually you have to tender again. So thank you.
Thank you, Matthew, for that. I'm going to hand back to Joe and Paul. Is there anything you'd like to say in summing up, or have you got some clear pointers for going forward from that conversation?
Yes, I think so. Thank you. The only piece I was going to add, from kind of going back to the beginning, people asking about the rationale for this, I think it was described to you two originally, and was certainly when they were talking at the first meeting about a roadmap. The question was, what defines success in this? And it was described as a service to patients, because GPs couldn't cope. And it's a personal observation again, but if people are getting, if the uptake is as small as it sounds as it is, this year of all years, then is there a real need, and what's the value for money? So I think that's one stream of questions. And the other one, as I said before, is about the transparency that's being provided to us in this, and then the specifics about some of the data and who's compiling that and how is it being verified and what's the objectivity. And I say I'll talk to Joe again before March, and we'll put together a list of bullet points that I can take. Does that make sense, Joe?
Yeah, I've got nothing further to add apart from echoing Councillor Richardson's point to say if Livy couldn't have been a success in this year of all years for virtual appointments, then is it needed?
Absolutely. Can I just say a huge thank you to Paul and to Joe for that feedback and update. Very detailed and really interesting, and obviously stimulated a lot of debate, as of course we thought it might. So thank you for that. Matthew, you've still got your hand up. Did you want to say anything as a final point, or?
No, that's a legacy hand, as they say.
Okay, thank you very much. Well, I'm going to conclude the business at that point. I'm just going to say our next meeting of the committee will be a joint meeting with the Health and Wellbeing Board on the 11th of March. It'll happen at 2 p.m. It's going to be looking at the commissioning intentions, and the next meeting of this committee will take place on the 31st of March. So 11th of March is the joint meeting with the Health and Wellbeing Board, and then this committee's meeting will follow on the 31st of March. And I say a big thank you to everyone and wish you all a good night. Thank you. Thank you very much for participating.
Thank you, Chair.
Thank
you. Good night.
Good night.
Good night.